Hello everybody, good day. So my name is Eugene. I'm a psychiatrist from Malaysia, and today I've invited two people to talk about mental health profession in general in Malaysia. Particularly, we are going to cover the role of the clinical psychologist, the counselor, and also the psychiatrist. So with that, I would like to introduce two of my friends here, Fang, a clinical psychologist, and Suen Lim, a counselor. All right.
Hi.
Hi everybody. So mental health profession, it's up and coming in Malaysia. Mental health is getting more and more exposure in Malaysia at this day and age. We are learning more and more about mental health, and acceptance rate of mental illness is beginning to grow more and more. The thing is, I keep getting questions from the public in the sense that where should I go when I do need to seek help? Do I go see a counselor? Do I see a psychologist? Do I come and see a psychiatrist? And there seems to be a confusion among the mental health profession roles among the three of us. To make things even more confusing, a lot of the things we do actually tend to overlap significantly. So today, I like to make this video to just have a brief description on each of our individual roles, what we do in our day-to-day clinical practices, and then hopefully be able to guide you or give you some pointers on how to seek help or where to seek help if you do need it. So then I will actually just want to start with Suen. Maybe you could tell us a bit more about your day-to-day life as a counselor. What do you actually do?
Okay. I actually freelance as a counselor, so I'm attached to a something that's up and coming in Malaysia as well, which is an employees assistance program training company. So that company will they are the outsource for companies who want like counselors to come in and training providers as well. So that is, I wouldn't say day to day because of the freelance nature of it. But we basically do come in and we provide counseling sessions to the employees, and the company pays on behalf of the employees. So I see that as we see that as an early intervention for the mental well-being and emotional well-being of the employees or workers. But I guess in that sense, and they will come in and they will talk about their issues they might be facing. Sometimes it's concerns, personal, family, or life concerns, relationship concerns that are stressful for them. And of course, there's also the emotional side of things, anxiety or depression. But importantly to note that they're still functioning at what we call a high functioning level. So their daily functioning is not affected. They're still coming to work. They're turning up for the sessions, and so that we're able to work through it together with them and teaching them certain skills. And also there's some assessments that we can do, but it's usually not a diagnostic one. It's more of a exploratory one, understanding where they are at and things like that. Yeah.
And Wenfang, what about yourself? What's your day-to-day like as a clinical psychologist?
Okay, so actually for me, I practice at 3 different settings. So it's quite a good mixture. So first of all, I work with an NGO clinic. It's a refugee-based NGO clinic. So over there, I see solely refugees. And over there, the caseloads that we have would be predominantly refugees from different countries. For example, Afghanistan, Syria, Burmese, Pakistan, and also I think just a lot of other different countries. And over there, we do predominantly assessments as well as therapy, and we do run a support group as well for the Afghan women refugees. So over there, most of them, they suffer from post-traumatic stress disorder, and also I think a lot of them, because of the nature of their issue, they suffer from complex grief and loss as well. So that's part of my work. And then secondly, also, I work part-time with a local NGO. And over there, I see more local cases. So the nature of my work there would be similar to the refugee clinic also. So I do more assessments as well as psychological intervention. And in my own private practice, where I see my own clients, non-NGO setting, so I think the only difference there might be the rates or the charges, but otherwise, the work that I do across board is the same as well. Yeah, so just some idea in terms of the nature of clients, maybe between refugee and non-refugee population. So like I've mentioned earlier, for the refugee population, a lot of them suffer from complex trauma and PTSD. But for the non-refugee population, on the other hand, I work with, I would say, a wide range of issues. So it can be from stress, marital concerns, or even individual, maybe interpersonal conflicts, and also clinical disorders as well.
Yep.
Well, compared to you, I think my job scope is a bit much more narrow. I work in a university setting, which means I teach students, but at the same time, I run my own clinics. Basically, we will see patients that are referred in from outside, and we deal with disorders, clinical disorders mainly. It's a bit more simple, but I do on the sideline do work with NGOs and also various freelance basis if they require me to invite me for talks or. And in fact, the EAP that Suen Lim mentioned, I do have some experience with that also. Mainly also talk about mental health well-being, but I don't do intervention for those kind of programs. Okay, so given the wide range that you have just described, if I were to ask you to summarize your job, your role as a clinical psychologist, as a counselor in a very, very brief, condensed form, how would you go about to actually, describe that? Maybe you can start with Wenfang.
Okay. I guess I would like to emphasize that we don't prescribe medications, because I think the public, they often have this misconception and they would mix the roles of psychiatrist versus clinical psychologist.
Yeah.
So yeah, we don't prescribe medications, but we do predominantly assessments, diagnostic assessments, as well as therapy, whether it's individual or group.
Can I jump in here with a question? Because for me, like I've always wondered as well, like so the clinical psychologist does the assessments, the diagnostic assessment. So does that mean when you provide the report, is that the diagnosis, or do you still have to work with psychiatrists to, I don't know, like officialize the diagnosis or something like that?
Yeah, yes, definitely. I think it's really good for us to work together as a team. So I think it's perhaps easier done, especially in settings like hospitals or even in clinics in the multidisciplinary team. But in the private setting, I think it's also for us to connect with the psychiatrist or even any other doctors that will refer the clients to us.
Okay.
To kind of inform them whether there's any clinical diagnosis or what's the outcome of the report, so that they can also kind of devise their treatment plan accordingly.
And on that point, I do actually kind of agree, because the clinical psychologists do have the skills for assessment that sometimes go much more in depth than what I can do in maybe half an hour, an hour. So the assessment tools, the way you were trained to do it, I think it will actually provide a much bigger holistic picture on diagnostic. And if given a chance, I would definitely usually we work together with the clinical psychologist to get more understanding on the diagnostics. I wouldn't put a clear line to say only psychiatrists can make the diagnosis. However, a psychiatrist will need the diagnosis in order for us to come up with the medication prescription and also the management. But of course, once we go to management point, I think it will always overlap with all other mental health professions, not just the three of us here. It could even go as far as rehab and also various other social workers and so on and so forth. Okay, so what about you, Sam? If you were to condense your description as your job?
I guess the condensed version also provide therapy as a clinical psychologist too. But we don't do diagnostic assessments, but we are there in terms of help, support, and encouragement. We have our own tools or toolkit to help the client improve their overall personal life and mental health functioning. So I think on the scale of health, which is mental health is similar to physical health, perhaps we are on that higher end of the scale. in terms of health. So also you can see counselors in other settings, like even places like Nirvana, the funeral homes, schools, colleges, universities, NGOs as well are also there. And I guess we're trained in terms of the counseling skills to listen, to really hear out the client's or the person's story, and also knowing when to refer either to clinical psychologist or psychiatrist, or even to other medical professions if it's helpful. So yeah, I think that's pretty much it.
On my side, first and foremost, we are usually medical doctors first. Nobody jump straight into psychiatry and become a psychiatrist. We are usually medical doctors. We will train in basic medical sciences, and then later, if you're interested, we join the field of psychiatry, and then subsequently specialize into psychiatrist. And because of that, one of the biggest job scope that we have is prescribing medication for psychiatric illnesses. That being said, there is a shift in terms of how psychiatrists, especially the modern younger ones, on how they actually approach it now. A number of us are actually more being trained in psychotherapy, so we do also give our own therapy, maybe a shorter version given the time constraints that most of us will experience. We only have 400 or so psychiatrists in the whole of Malaysia. There is a very big shortage of it. So even if we do therapy, we cannot afford the same time as the both of you all. It's usually a very short, brief one, or maybe very selected few cases. But that being said, usually we are very well aware of our limitations, so we will refer accordingly also. But it's always, I do agree that was mentioned just now, is that sometimes even I get confused. Do I refer this case to a counselor or do I refer it to a psychologist? I don't think there's a right or wrong answer with that. I just think that because the job scope tends to overlap here and there, so sometimes it's just both also we could refer to. It's just that it's not so clear cut. And anyway, speaking of that, psychotherapy, what are your thoughts in terms of each of us delivering therapy on your own? Do you feel that it's an exclusiveness that only a counselor can do this form of therapy, only a clinical psych can only do this form of therapy, or anyone can pick up and then adapt within their own fields? What do you think about it?
I think that's a very good question, because I do see that there's a lot of overlaps in terms of that as well. So I don't think that we should create like such a clear distinction that certain cases should only go to the counselor, certain cases should only go to the psychologist. So I would say that maybe I can speak for clinical psychologists in terms of our training. Like we are trained to conduct evidence-based treatments, and there are so many different modalities as well. And I would say that counselors are the same also. Like you are also trained in that aspect too. But just that for us, I think in our training, we learn how to devise appropriate treatment plan in accordance to whatever issue that the client is presenting, and then that would inform us in terms of the direction that we want to work on in therapy.
Your thoughts?
Yeah, I think all of us would have touched on psychotherapy. I mean, if we break the word down, it's therapy and it's psychology. So it's like physiotherapy. So it's therapy for physiology. This is therapy for psychology. And all of us are in the same field. In that sense, we're all trying to help people's psychology and mental well-being. But I guess the scope, and like you say, it's the time and the expertise. So perhaps like for Eugene, your training or your expertise is mainly in terms of the medical, your medical doctor first. So the medical treatment and expertise is there. And then for Fang, it's the clinical psychology part of things. You actually study like the brain, everything's very evidence-based. You go deep into the assessments. I mean, the Bible, DSM-5, you know, you would be very familiar with that as well. So that would be your expertise. And I think with the counselors, our skill is we are trained mainly in the counseling skills of it. So how we deal with the person. And I think in terms of diagnosis, perhaps we are not as trained in it, but we have to be aware of it so that we can then work together and then provide this holistic psychotherapy in a sense to the person who's seeking help. Yeah, so that's why sometimes I find it difficult to define. But I think someone did, or perhaps it's, you know, somewhere I read somewhere that if we define it across the spectrum of health, then I think that is helpful. So
How would you do about defining across the spectrum of health? When you say
so yeah, so if let's say it's similar to physical health, okay, I won't claim this. Definitely one of my supervisors taught me this. So if we go across like physical health, so you are sick, let's say you have to be hospitalized, then yeah, definitely go see a doctor. And then you are struggling, you're definitely unhealthy. But you know, you're not hospitalized, then yeah, maybe it could be a physiotherapist at that point. And then you're still kind of healthy, but you know, maybe a bit overweight and you want to improve on that before you get to the unhealthy state. So then you might see a fitness coach, a nutritionist, dietitian, you know, things like that. So that spectrum of health. And then I guess if we look at it from mental health perspective, it's kind of similar as well. So if I need medication right here, I'll go see Eugene, psychiatrist. And then if I need, you know, I'm like going through trauma, like every day it's anxiety, it's really affecting my daily functioning. I'll see the clinical psychologist first, who might work together here with the psychiatrist. But maybe before then, I still can go to work, I still can get out, I still can take care of myself, but I can feel it, I'm struggling, it's stressing me out, it's getting harder and harder to get out of bed, then yeah, maybe see the counselor then. Yeah.
I like that description, but one way I usually like to look at this, instead of a singular line, there would be a circular one. I will put this up on the video.
Yes.
Where actually the roles are actually intertwined, they do overlap significantly. So yes, I do agree in terms of health. Maybe that you know, you're very healthy, you see a counselor. Somewhere in between, you start looking for a clinical psychology, and when you are very unwell, work a clinical psychologist and a psychiatrist together. But I would say that even the counselor, even at that end of the spectrum, they would still be some role. And the overlaps is often very difficult to clearly define. It's just that how much we can contribute. From what I'm hearing here now, from what you all have said, so if I were to summarize, as much as I don't like it, psychiatrist mainly is giving medications. Yes, we have to agree with that. That is we are licensed to do that, and that is a clear thing that only I can do.
Acceptance.
And on your part was you can't give diagnosis, but you are a very supportive role in order to identify and work with the clients who are experiencing difficulties. And that you might even have simple interventions that might be able to support and push them further. And when you come somewhere in between this, where you are able to do the assessment, and if they don't need medication, you are also even able to do the intervention. And the diagnosis, you have the tools to make the diagnosis, but the final diagnosis would ultimately fall back to a psychiatrist to say that this is definitely this. Would that be true? Okay. So I think that's great. I think that kind of paints a nice picture. It's not a black and white thing. At the end of it,
I like how you have the circles with the overlap, because there is ongoing support that all three of us can provide.
So now that now that you get a better picture, how do we go about getting help from you? For my side, it's simple. We generally work from a referral system. So a GP or clinic kesehatan, they will actually write a referral and come and see us, get an appointment, and they could see us either in private or in government, and then we will just see them based on the appointment. I do know psychiatrists who deal entirely with medication. They don't want to touch psychotherapy at all. And I do know there are psychiatrists who work with majorities therapy, minimally medication. There is a whole range there. So I can't actually even tell you which one goes to which. It's a huge range. But we do usually have some form of gateway at the very beginning to screen through, say which one will actually end up getting an appointment. Wen Fang, on your side, how do, if someone needs to see a clinical psychologist or interested, of course, on my side or student side, we can refer to you. Yeah. But what else how do you get patients to come and see you?
I think perhaps it depends on the setting, because we also work at a wide range of settings. So let's say, for example, in a private setting, I think a lot of clients, I realize they would go online, they would Google, maybe they would choose based on the therapist profile, or maybe based on the location. It really depends. And some of them, it's also by word of mouth, maybe referred by another client, or referred by just our connections, like doctors or therapists. But I think in a hospital setting, then there's a more organized referral system, or even in a clinic setting, it's more organized.
And Suen, yourself, how do you get clients or patients?
Yeah, well, for me, I think it's a bit different in the sense that we have the company involvement. So usually we do the first session with all the employees, and then after that, we assess, and then we continue with the appointments. So there's the company, and then I think even school settings, either maybe the teachers refer, or the kids will come in to see the counselors themselves. Usually it's quite direct, I guess, or someone else who is not in a medical profession may refer them to a counselor. And I think there are a lot of counseling centers, psychology centers that people seek out and find counselors from there, and private referrals. Yeah.
Okay. All right. So I think we pretty much covered our all three roles here: the counselors, the clinical psychologist, and also the psychiatrist in our day-to-day practice. And I hope that whatever we discussed today did give you a better view and understanding of mental health professions in general in Malaysia. And if you have any questions, feel free to leave it in the comments, and I'll try my best to answer. And of course, click like and subscribe if you would like to see more of this kind of talks. So with that, thank you everybody. We see you all soon.
Thanks.